I'm leaving.
Especially you, Chad. Okay, how many of you here have never been here before? Never been for any of our workshop? Anybody? By a show of hands, unless you have a frozen shoulder, raise your hand way high. Only one person? Everybody else been here before? Awesome. Excellent. Anybody has any questions about improving your gut health? Anybody? It's really a class on the prostate. Anybody wants to be listen to that? She says, I'm out. Okay. Got a pad of paper. Great. Some of you heard this before, but how many of you remember who Steve? Oh, I saw this picture today of. I was thinking that this crowd here tonight will be just a little bit older and wiser. Right? You guys remember who Patrick Swayze was? Right when Patrick Swayze, when he passed away, according to most of the stuff that I've read, he was worth $40 million. And if I ask any one of you here tonight and say, you know, would you agree that's a lot of money? Yes. And if I was to ask you, you know, would you be willing to trade places with him? Obviously, the answer is no. Right? Obviously. Right? He was worth a lot of money, but yet, you know, he's nowhere to be found anymore, unfortunately. And I was thinking that whatever value that you have, whatever matters to you in your life, right? If you don't have your health, obviously it's going to be harder to get to what those goals are and dreams and whatever you have on your bucket list. Would you agree with that? Yes. Right? So in the next hour or so, I'm going to try to keep this short. Sometimes it's hard, but I'll do my best. She's laughing. I know she's laughing. But right, our goal here is I want to kind of shine the light on some of those on that particular subject of gut health. We're going to talk about symptoms. We're going to talk about condition. We're going to talk about whatever you want me to talk about. I mean, maybe there's things I don't want to talk about, so I'm just going to ignore your question, just like a good politician. And maybe at the end I'll answer a few questions, or maybe many questions if you have some questions left. Right? My goal is always to try to answer as many questions as I can as I go through this, and then to give you the opportunity of like taking it to the next step, whatever that next step is. Right? Every one of you here tonight. Maybe there's already many things you're already doing great. Maybe there's something maybe you'll be adding to your list of the things you want to do. Does that sound fair?
Yes.
Right? So this being said, we're going to just jump in into this, see if the technology works. Hopefully it does. This is the best that I could find. I was on the plane last night at midnight. And I was trying to find some pictures, but I didn't have access to the internet, so I had to go on my app. I have anyway. Let's move on. This is the best picture I could find. This is your heart, just so you know. Not yours, but you know, somebody like you. So as it relates to the digestive tract, there's a lot of different organs, and it's always interesting to me when people say, you know, my stomach hurts. I'm like, show me your stomach. And they're like, you know, or they're like, that's my stomach. I'm like, oh, your stomach is not there, right? So, you know, is it like above or below your belly button? Which height that is? Is it at the top? Is it at the bottom? Because that does matter. So right here, I want you to put your hands here on the right side, right below your right breast. That's your liver, yes? This whole hand, the liver is a big organ, like it's bigger than your hand. And then right underneath that, right, that's where your gallbladder is, which probably some of you here don't even have your gallbladder anymore, which is not uncommon, because in the medical profession, your gallbladder is like a spare part, right? You don't really need that. So your gallbladder is right here underneath your liver, see that? Then you have your stomach. That's why if you sleep on your side, on the left side, and your stomach is full, you're less likely to have an acid reflux, right? But that's not taking care of the problem. I'm just giving you a hint. And then this little thing right here behind, anybody knows what that is? I have like a little shiner here, but you know what that is? Behind the stomach? That is the pancreas. And then right here on the far left, this is right here, mid-axilla on the far left, Yes, right below your rib cage, that's where your spleen is at. And this is where you're recycling your red blood cell every 120 days. It's part of your immune system too. And then here you have your large intestine, and then right in the middle you have the small intestine. Yes or yes? And everybody says yes, because we're gonna be here all night if you don't say yes.
Yes.
Okay, just want to make sure we're just setting you understand what I'm talking about. Your liver, I don't want you to be like this, because that's not your liver. Okay, fair enough? So now we have a reference for, this is your digestive system. So tonight we're going to be talking about all the symptoms that people have and the condition that people have when they have issues with their digestive system. And I'm going to talk to you about from a holistic perspective. So if we haven't met before, I grew up on a farm, if you did not know that. My parents were farmers, their parents were farmers, we grew vegetables. And my whole background is in this nutrition world. You know, you just eat the fruits and vegetables with dirt. And unless you eat at least a pound of dirt, you know, you're never going to be as healthy as you can be. So eating dirt is good for you, just so you know. And then in my education process, I studied to be a personal trainer, and then I got a nutrition degree because that's really of huge interest to me. And then after that, I got a doctorate in chiropractic. I became a chiropractor. Then I started a master's degree, but then my wife says, you need to go to work, right? So enough of this studying business. Let's go. So then I never finished that. So the perspective that you will be getting tonight is from a holistic perspective, which I think that is something that is important. Why is that important? Because there's a lot of different professionals out there, and they all have their expertise, and everybody wants to just like, if they're a carpenter, they just want to, everything is a nail. So I'll give you maybe a few different ideas on some of those conditions and symptoms. Fair enough? You're supposed to say yes.
Yes.
Here's the problem. Ready? So there's 50 million people that are taking those proton inhibitors. You guys know what proton inhibitors are, right? So if you're taking like, Privosec or any of those anti-acid medication for your acid reflux, yes? Lots of people do that.
Yes.
I mean, only 50 million people are taking it every day because supposedly, your body's not very smart. So then you need a pill. So tonight, there's one concept I want to bring around I want you to be thinking of. Like, if I was to say to you tonight, do you think that people have headaches because they don't have enough aspirin in their brain?
No.
The answer is no. Do people have acid reflux because they don't have enough Tums in their belly?
No.
The answer is no, but yet people do it every day, right? They're like, when I take the Tums, I feel better. And I'm like, that's good, but we can all be smoking dope here. We're going to feel better. It doesn't mean it's good for you, right? So we want to find out what's causing the problem. So we want to get to the cause, not just the effect. If you take a blood pressure pill and your blood pressure goes to 120 over 80, your blood pressure would look good. The doctor would say, hey, you know what, your numbers look good, but is the problem still there? The answer is yes. You don't want to get to the cause, right? So all of what we've been talking about today is we want to get to the cause. What's causing the problem? Not just getting rid of your symptoms. There's about 60 to 70 million Americans that have gastrointestinal disease, so that's a lot of people. Right, there's 4 million people that are dealing with constipation. There's 2.5 million of ththose people, they have like doctor's appointment because they're full of crap. How's that sound? Now this is very interesting, so I want to tell you a story as we go through this, just to make you laugh a little bit, because you guys are like way too serious. But this lady one time early on, I've been doing clinical nutrition now for close to 25 years, and this young lady, she's only 21 years old, and I asked her, I said, when you have regular bowel movement? And she said, Dr. Jean, yeah, I do. And then my next question was like, what does that mean though? Right? What does that mean? Then she says, well, once every 3 weeks. So for her, that was regular. She didn't know any better. So sometimes what you think is normal might not be normal because you don't know any better. Or you've never asked, or nobody's ever asked you the question. So you should be pooping every day. Otherwise, you're just full of crap. Yes? So here it says 25 to 45. Right, 25 to 45 million people are affected by IBS, which is irritable bowel syndrome, which is common. There's 150,000 people that die from colon cancer every year. There's 22,370 people that will have esophageal cancer every year. And those numbers are quite conservative. So there's lots of people that have gastrointestinal issues. And then one of the things that you never want to say to Dr. Jean-Guy is, you never want to say to me, that's normal, I'm getting old. People say that to me all the time. They're like, I'm getting old, isn't it normal? So from tonight on, I want you to be thinking here, we're gonna use different words. Are you ready?
Yes.
I want you to say it's not because it's normal. It's not because it's common that it's normal. Okay, we're gonna say that all together. It's not because it's common. Come on. It's not because it's common that it's normal. Something common doesn't mean it's normal. And people say that all day long to me. They're like, well, Dr. Jean-Guy, I'm old. Isn't it like normal? I'm like, it's not because it's common that it's normal. Is that fair?
Yes.
Because that's really important that you start changing the way you think, because if you change the way you think, then you're not going to be like blaming, I'm just getting old. Getting older doesn't mean you're falling apart. I mean, it might feel this way if you don't know how to take care of this fine machine, right? If you have this nice car and you just put water in the gas tank, it's not going to work right, yes?
Yeah.
It's the same thing in this body you have. So here, let's talk about symptoms for a minute. Those are all symptoms of gastrointestinal problem. Sometimes people do have gastrointestinal problem, they don't know they have it because they don't understand the symptom. So people that are bloated, they have gas, burping, belching. I have people right now, I should have put that picture there, but I guess HIPAA violation, one we didn't see her face. She takes a picture down her belly. She's like, look, I look like I'm 9 months pregnant, her belly's like that. And she's only like, she's not pregnant, right? And she's only like 40 years old. So that's not normal. So bloating, gas, burping, belching, constipation, diarrhea, hemorrhoids. I feel full, look like I'm pregnant, my stomach hurts, acid, reflux, GERD, heartburn. Did you know that those are all the same, yes?
Yes.
Oftentimes I ask people, I'm like, are you tired? They're like, no, I'm fatigued. I'm like, okay. But to people, sometimes it means different things. So just like I just repeat what they say to me. I mean, in my mind, it means the same, but to them, I guess not. So I ask the question, are you tired? So acid reflux, GERD is the same. Being nauseous after you eat. People will eat, they're going to feel like they have like mid-back pain. It's squeezed on the inside, right? So those are all symptoms of gastrointestinal problem. Now those are conditions that they're going to diagnose you with, and then they'll give you a pill for it. Yes?
Yes.
In case you did not know, it says the first one is called gut dysbiosis. That means that your microbiome is being affected. Then sometimes people are being diagnosed with leaky gut syndrome, IBS, colitis, Crohn's, diverticulitis, celiac, fatty liver, pancreatitis, SIBO and SIFO, small intestinal bacterial overgrowth. Yes? So when your small intestine doesn't work properly, and then you have overgrowth of, some of those bugs. So it's very common, people like this microbiome. I'm just gonna tell you a little bit about drugs here. When you take 1 round of antibiotic, 1 round, according to many medical papers, the medical literature, that 1 round of antibiotic, it's gonna take 2 years for your gastrointestinal tract to recoup from that. Right, for your microbiome to recoup, meaning that your microbiome is all like the bugs there that are in there that are creating balance into your body, that are, if you were to take a flight, they do stool studies and they take a flight, the person leaves from Boston, they take a stool sample, and then they look at their poop, and then they fly all the way across country, and then they go to California. And then they get to California, and then they have to poop again, right? I mean, I don't know who signs up for that, but. And then they look at their poop, and what they find is, the bugs and the environment, the poop is completely changed, what you find into the stool sample. Because your body will just adapt just like this and start changing really quickly, right? So people would say something like, I know it's never happened to you guys, but you leave Michigan, this is where your home is, and then you go down south, and then you don't poop. Right? Or people, they change one state to the other, and then they'd say something like, hey, I felt so good when I was here or there, because the environment changed. When the environment changed, then your body changed. You follow me?
Okay.
So I want you to think of that here for a minute. I'm going to circle back to those antibiotic things, because that's a big deal. Every time you take 1 round of antibiotics, 2 years for your gut. right? So Dr. Junkie is not a big fan of just like, when people come in, I usually don't say anything, I bite my tongue real hard. Real hard. I do hear a lot of things that I don't like to hear, because they just think I'm a little crazy, but I just want you to know that there's usually good reason. I'm a firm believer that you want to make sure that you take care of yourself, and we want to do everything we can at all costs. I'm not opposed to medication, but what I'm opposed to is every single medication that you take, right? If you give a medication to anybody, a medication to a person that is healthy, they're gonna get sick, yes? If you did not know that, just so you know, side note. So if you don't need the medication, would that be a good idea not to take it?
Yes.
And every single medication have side effect, yes or yes?
Yes.
The answer is yes. Now let's say the side effect only happened 1% of the time. If it happens to you, that's 100%, yes?
Yes.
Okay. So this being said, right, Dr. Junkie's mind, I'm like, hey, God is not stupid. So when you have symptoms are just an expression of what your body's trying to do in order to heal itself, yes? And you want to try to find out the reason for that. So if a person was to have acid reflux, then the question is, why? Very good, right? If you were to have constipation, the question is, right? If you were to have like, you get nauseous after you eat, the question is, okay, very good. If you go see the doctor and you're like, hey, I've got this symptom, that symptom, and then we give you a pill, is that taking care of the cause? It's taking care of the effect. It's taking care of the effect, not the cause. I want to find out what's not working properly and then fix it. But if you don't know what's causing it, then you can't fix it. Yes?
Yes.
Okay. So when I first started in practice, for those of you that are new, some of you here, you've been here like 100 times. You can probably do this for me, but I want to show you this here. Remember I said we're going to talk about from a holistic perspective, right? Your brain is in charge of controlling 70 trillion cells. Can you say that? 70 trillion cells. Your brain is in charge of controlling 70 trillion cells, right? Your brain is in charge of controlling every single other system in your body. So what that means is your brain and nervous system, if I say to you tonight, what controls your immune system?
Brain.
Your brain and nervous system. What controls your cardiovascular system? Your brain and nervous system. What controls your lymphatic system? Your brain and nervous system. What controls your psychology, right? And today there's a lot of research in psychoneuroimmunology, right? What's happening here upstairs is controlled by what's happening into your nervous system. So now let's pretend here that your spine and nervous system, your spine, right? There's 24 bones in your spine. They're covering the spinal cord. And in order for your stomach to produce digestive enzyme, your brain has to send the right message at the right time. So when you put food in, there's a negative feedback loop that tells the brain, hey, this person, with this person putting food in their body, so now we need to produce digestive enzyme. But let's say that this message here is not being relayed properly. Guess what's going to happen to the stomach? Is the stomach going to be able to digest this food properly? Yes or yes?
No.
The answer is no. That was a trick question, right? I mean, you better watch. The answer is no. Do you understand that you got to have the right message at the right time? That's why a person can, if they have damage to their spine and nervous system right here between your shoulder blades, and if this is interfering with sending the right message at the right time, that's the reason why you can give a chiropractic adjustment to this person right here, and then their acid reflux goes away. Yes?
Yes.
Now it doesn't happen 100% of the time, but would you think that it's worth looking to see if it's there?
Yes.
So when I first started in practice 20 plus years ago, Kim comes in on a Saturday morning, 10 o'clock. She says, Dr. Junkie, can you adjust me right here? And I said, who's the doctor? Is that me or you? She says, oh, I'm sorry. I've been going to the chiropractor my whole life. And then what happened is when I have acid reflux and I get adjusted right here, then my acid reflux goes away just like that. Right? So she understood that if this is not happening properly, that you can be taking all this other stuff, right? We're going to talk about like some really great stuff here tonight. I'm going to give you all kinds of insight. But if your brain is not capable of sending the right message at the right time, if your nervous system doesn't function properly, it's going to affect all those other things. Yes? Does this make sense?
Yes.
So we don't want to be thinking in only one dimension, because sometimes there's more than one thing that can be affecting other things. Yes?
Yeah.
Okay. So those are, I probably left some of those conditioned out, but those are common. Those are the ones that we see on a daily basis that I've seen many, many times over the past couple decades. So here it says, what can we do about it? It says, whatever you're doing, are you taking care of? Or, and if you want to take care of the cause, you need to ask the question. Whatever symptoms you have, you want to be asking the question why. If you have a headache, the question is, why do I have a headache? Do I have a headache because I have a lack of aspirin in my brain? Yes or no? The answer is no, but people take the aspirin every day, right? They're like, well, Dr. John, you have a headache, take the aspirin. And I'm like, that's stupid. No, I don't say that. I just think that. I think that. I don't say it. I mean, earlier in my career, I would say it. So I've been afraid of telling people this for a long time, but now I decided that at every single workshop until the day I die, I'm going to tell people. Right? My wife and I, we have 5 children. We have 7 grandkids, 5 kids. And those 5 kids, you know, Denise and I, when I married my wife, she had 3 kids. And then after that, we had 2 more that were born at home. Right? And I always tell people I delivered my last 2, and she's like, well, you didn't do anything. I'm like, that's rude. I did all the work. Right, and as soon as they were born, as they came out, right, it was just her and I. She was in a birthing tub, you know. She's in the pool. Baby comes out, the umbilical cord is attached. You know, this baby got their first adjustment as soon as they were born, and then after that, cut the umbilical cord, and then start nursing. Right, that's how it happened. And then thereafter, for the next 18 years, right. Matter of fact, with the other ones, the other 3, right, for 18 years of their life until we kicked them out of our house, right. Those kids, they have never taken any drugs. So no aspirin, no nothing, right? The only thing they've had their whole life is a chiropractic adjustment and nutrition. So I want you to think here of this, right? People are like, well, sometimes people say, well, that's just luck. I'm like, well, I mean, you can have luck 1 time, but not 5 times. Would you agree?
Right.
And the reason why I'm telling you this is not because I'm any better than you. I just want you to believe that there's like, it can be done. It can be done when you understand how God made your body to work. If you don't understand how God made your body to work, then your life is being driven in fear, right? You live your life in fear every day because every symptoms, you know, doctors are like, we need to go see the doctor and he's going to give you a pill for that. And we don't want that. At least I don't want that. I want you to know that it's possible if you choose to. Now, I'm not telling you Dr. Junkie I'm not opposed to doctors. I have friends that are doctors. I'm not opposed to go see them if somebody's going to die. Right? I mean, I'll go to the emergency, something's broken. But I'm just telling you, for 18 years, 5 of them, they've never taken anything. Is that a pretty good stats?
Yes.
Right? I would think so.
Yes.
And I would also like to believe that if it's possible for me, it's possible for you, and it's possible for all my patients, all the people I've taken care of. Right? There's a time and place for it. However, when people are taking several rounds of antibiotic, you know, year after year after year after year, because they're like, oh, I got a head cold. And I'm like, who cares? Right? Just suck it up. I'm just kidding. You're like, well, you have a lot of compassion. I mean, I don't have a whole lot. But what I want you to understand is I want you to you know, just grasp the big idea here that your body was designed to heal itself. And when there is a symptom, then you want to ask the question, why? And say, why is my body doing this? If you were to have a virus and you start having diarrhea, is that health or that's sickness? I mean, for most people, they're like, yeah, my kids are sick. I'm like, no, they're not sick. They're expressing health, just like you would. If you have diarrhea and you have a cold, then what happens, that's how your body is cleansing itself. Right? So when kids come in, they're like, yeah, my mommy and daddy didn't bring me on Monday because I was sick. I'm like, what does that mean? Well, I was just, you know, they're all embarrassed to tell me they were just crapping their pants. I'm like, well, that's good. That means you're healthy. And then they look at me with big eyes because they're like, well, my parents didn't tell me that. My parents said I was sick. I'm like, yeah, when you don't understand what your body's trying to do, then you don't understand what you don't know what you don't know. And if you keep telling this to your kids and you keep telling that to yourself and you're like, well, I'm sick. No, you're not sick. You're expressing health. That's different. If you have a cold and you just, you know, you have diarrhea, you're expressing health. You're doing exactly what's supposed to do. When you have a bug in your body, you have the core temperature goes up in your body. Are you healthy or you're sick? Right? For most people, they're like, oh, I'm so sick, I have a fever. I'm like, yo, you're not. You're healthy. Because if there's a bug in your body and yet you don't have a fever, how are you going to kill the bugs? Those viruses, guess what? You can only cook them at a certain temperature. And if your temperature doesn't go up, then you're not doing what you're supposed to do. Right? You have to understand that. Not only understanding, you have, like, once you understand it, you need to tell other people. You need to tell your kids, you know, because people call me all the time. They text me. I mean, I get hundreds of per day. right? Families, moms, they're just like, well, my little Johnny's got a fever. What do I do? Nothing. But Dr. Jean-Guy, the temperature's 102. It's high. What do you do? Nothing. How about 103? Nothing. How about 104? How about if you just get rid of your thermometer, then you don't have to worry about it? You know, we've never had a thermometer because my wife didn't care, and I guess she doesn't care. I don't care. So when those kids, you know, they weren't feeling well, what did we do with them? We just, you know, I guess you cuddle them. I mean, I didn't do that because I don't have much compassion, remember? And then you give them a blanket, and then you make sure that they don't get dehydrated, right? And then you get them adjusted. People call here, they're like, I'm sick. I'm like, what's the best time to come in? But I can't leave the house when I'm sick. I'm like, why not? Right? Now, of course, this beautiful 4 years that we had with COVID, you know, everybody's been trained that you got to stay at your house. But I want you to know that. I also want you to think of that. I'm not really supposed to say that. Hopefully I'm not recorded. You're probably recording me somewhere. So why for 4 years from 2020, right? And then 21, 22, 23, right? The Dr. Jean-Guy took care of people with before COVID, while COVID, after COVID. People went to their house, right? I did all of this stuff. Didn't change anything, right? Nothing changed. Life as usual. Life as usual. I want you to think of that here for a minute. No COVID at our house, none of that stuff. You know, and again, we're not any better than anybody else. I just want you to know that this is really important, especially right now for some of you here. And I'm looking at you and some of you, besides this young lady here, she looks like she's 12, but the remaining of you here, you're getting up there, just like me. You're all getting up there. And I want you to know now, listen to me for a minute, right? That if your immune system doesn't start doing this, you're in big trouble, right? I'm going to tie up this whole story here because you're like, where's he going? I thought we were supposed to talk about constipation and diarrhea. I mean, I'm getting there soon, right? But just think about this. If your immune system doesn't do this and you don't have symptoms and you don't work through the symptoms, your immune system's never going to get better. And if it doesn't get any better next time, because there's going to be a next time, we don't know when. I'm not into conspiracy. I'm just telling you there's going to be a next time. There's going to be other bugs out there. They're coming at you right now. So this week I was just explaining to somebody, or last week I was just explaining to them, I think this was Marissa's husband there. I was just explaining to him to say, hey, listen, now I want you to understand that. I said, some of you here that are wild like me, you don't have to be wild like me. Let's just pretend that you are, though, right? Or I'm making you more wild like me. And let's just say that you don't want to take drugs anymore. You're like, well, we don't do that anymore because Dr. Jean-Guy said, which you should never say that because, I mean, I don't know nothing, okay? I'm just telling you what I did. And then I want you to hear me here because this is really important, right? Let's say you don't do any of that stuff anymore, but the rest of the world is doing it. Now what's happening is we're creating those superbugs. Yes, if you've never heard the term, just go look it up. Dr. Google's going to tell you the truth for sure, right? So now you're having superbugs out there. Now those superbugs, they're getting stronger and stronger because we're trying to destroy them with the antibiotic. Yes? Now those guys, those bugs are just like human beings. They're trying to adapt and they're getting stronger. So now those superbugs are not just bad bugs, you know, with those people over there, and you don't have to worry about anything. Those bugs, they're out there for you. They're coming at you too. Even if you don't take the antibiotic, we still have superbugs that are stronger than they've ever been before. So now your body needs to be ready to handle them. So you need to do some of that. That means that you need to have a cold and you need to have a sniffle and you need to have all those things. And if you're going to make it through, you need to let it happen. You cannot say, well, I'm sick. Let's go see the doctor. No, you don't want to do that. You want to work through it. I know some of you are like, well, that sucks. You know, I won't be able to go to work for a day. I won't be able to watch TV or whatever you like to do, right? But if you don't do this, what happens is the next time, there's going to be a next time, just so you know. I'm not into conspiracy. I'm just telling you there's going to be a next time. And if your body is not prepared and ready for that, guess what's going to happen? So do you understand that those people that are on the sidewalk right now, they're masked on and they're just by themselves? That's a problem. Okay? And I'm going to tell you this. Now listen to me for a minute. I don't care what people do. They can have 3 masks if they want to. But the problem with that is when you're by yourself on the sidewalk, even if you have cancer, it's still bad for you. We've never done that ever, ever, ever. Even if you were to have cancer. You cannot be on a sidewalk with your mask on. It makes no sense whatsoever. You need to be exposed to the environment, to stuff that is not going to kill you. Because if it's not gonna kill you, it's gonna make you what? It's gonna make you stronger. Okay, now I'm gonna tie up this whole story because you're like, I thought we were here for constipation. Right? I'm gonna tie this up. Are you ready? Your gastrointestinal tract is 80% of your immune system. 80. So if this guy here is not strong, you're in trouble. That's the reason why we're going through all of this here. So in your body, there's 3 tubes. How many? 3 tubes. So you have the inside tube. It goes from your mouth all the way through your rectum. That's tube number 1. Tube number 2 is the blood. That's the second compartment. And the third compartment is your tissue. So this first compartment there, if it's not healthy, it has an impact on all those other compartments. You understand that? Right? So this gastrointestinal health is really, 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 really important. And it starts with your mouth. Right? It starts with what's happening in your mouth. Because your body will start digesting the food in your mouth, and then it's going to go into your stomach, and then it's going to go into your small intestine, and goes to your large intestine, and goes out. And along the way, you're going to have those other guys that's going to chime in. And those other guys, they got to work properly. Right? So, okay, we want to take care of the cause, not the effect. I think you guys got this, yes?
Yes.
Am I on time here? I'm going to be done within like 30 minutes? Probably not. So here, this is what happened. When people are digesting food, now listen, if you have a hard time to digest protein, you're gonna be gassy, and it's gonna smell, right? And you're gonna be bloated. Number 2 is you have those fat, they will turn rancid. If you can't digest fat properly, then you're gonna have nauseousness. You're gonna feel queasy. You're gonna have burping, belching, upper abdominal pain. If you don't process the carbs properly, then you're gonna have lower abdominal gas. You're gonna have constipation alternating with diarrhea. You're gonna have gurgly feeling in the abdomen. Those are the symptoms that people have when they can't digest those macros. Some of you, I'm sure you probably have had one of those, maybe multiple of those. So when people fart and it smells really bad, that means that you don't digest your protein properly. That's a problem. Right? I mean, don't look at your person next to you, okay? Even if they're farting. Okay? So this gives you some insight here of what's happening. So when you have some symptoms, you want to find out what's going on in my body. Now, after the age of 40 years old, besides this young lady here, remember, she looks like she's 12. I think she's 13 now. But the remainder of us, it looks like we're a little bit older. This one here, she looks like she's 22. But aside from that, we all look older. So now check this out. After the age of 40 years old, in your stomach, your digestive enzymes, they start coming down. You have less. You don't have as much as you used to, and you don't have as much hydrochloric acid as you used to after the age of 40. Now your stomach is your first line of your immune system. So what happens is when your stomach becomes more alkaline, right? When they give you those pills for acid reflux. Acid reflux, right? You have acid reflux. I had too much acid. So now we'll give you a pill for acid reflux. Whenever you take those pills and you make your stomach more alkaline, you make your immune system weaker. But that's okay. You don't have acid reflux, but we're going to die earlier. There's more chances you're going to have some. If you look on the label, just when you go home tonight, I know that you don't have to raise your hand right now. Probably some of you here are taking that stuff right now. You're going to go on the label, and you're going to read on the label, it says, number 1, you should only take it for a short period of time. People don't do that. They take it forever. Because once the doctor puts you on, he's like, we're never going to get you off this stuff, right? That's number 1. Then it's going to shut down the absorption of mineral like calcium. That's no problem. You'll have osteoporosis. We've got a pill for that. And then if you're not going to have enough iron, it's also shut down the absorption of iron. Well, that's okay. We've got pills for that too, right? And then your immune system is going to be weaker. But that's okay. We've got pills for that too, right? So now we're creating the disease. So we're just feeding the company, right, to make sure that, you know, the system is making profit out of it. Yes? And it's not even fixing the problem. I mean, if it was to fix the problem, that's okay. But your stomach right now, that's the reason why, if you have animals, how many of you here have animals? Dogs, right? That's the reason why dogs, they can lick each other's butt, they don't get sick. Why do you think that is? Because their stomach, if you were to put your finger into their stomach, you're going to lose your finger. Because it's so acidic, right? You're going to lose your finger. Pathogen will not get through it. Now, us human beings, it should be acidic, but not as much as dogs. So when you reduce the acidity in your stomach, then you cannot break down the food, especially the protein. And if you don't break down protein, you're going to have what? You're going to fart a lot, and it's going to smell bad, right? Because you cannot break down protein, but you don't have any symptoms. If you don't have any symptoms in medicine, we call you what? You're like, you're good, you're healthy. If your numbers look good, your numbers look good. It's okay to die early and suffer a lot, but, as we're killing you softly, you're feeling good. So now this is your stomach, that's your first line. So over time, by the time you're past the age of 40, your digestive enzyme and hydrochloric acid is less. And then when you eat, then from your stomach, it goes into your small intestine. And then in your small intestine, what happens is your gallbladder, right, your liver produces the bile. Where's your liver? Everybody put their hands on their liver. Make sure it's on the right side, okay? Make sure it's on the left side. All mess would be like this, right? It's on the right side, it's right here. Right underneath your liver, you have so your liver produces the bile, your gallbladder is the storage tank, and every time you eat, it's going to put bile into the small intestine in order to emulsify the fat. Now, if your body doesn't do that properly, right, people will have gallstone, or the gallbladder is not going to work properly. Now, the purpose of the bile is to break down fat, but also it does something really important. It gets rid of all the toxins in your body. So a lot of people today, you don't have to raise your hand, probably a handful of you don't have your gallbladder anymore, or if you've been around me and you're wild enough, you probably still have your gallbladder, but you try to fix it instead of having taken away. But the gallbladder, what it does, it's really important. It's your storage tank, and every time that you eat, it sends a message to your brain, say, hey, there's food in there, you need to be pushing some bile into the small intestine. And then what it does, it breaks down the fat, so then you don't have to have, when people have a bad gallbladder, they get bloated, right, or they get nauseous. Or they have a hard time with their bowels, because bile is in charge of, it's like a detergent, it cleans up the gastrointestinal tract. So if the bile doesn't move properly, then people get constipated, right? So the bile is really, really important, and it also removes the toxins. So today, the air we breathe, water we drink, and the food that we put in our body is toxic. So the bile is like, that's the way God made you. He's like, hey, listen, you know what, we got to plan for that, right? So we're going to use the bile to tag the toxin, and we're going to pull them out. And the bile also going to tag the excess estrogen in the body, so that's really important, especially for ladies, because today you see a lot of breast cancer. And those breast cancer, many of them are driven by what? By estrogen. They're estrogen cancer, right? So then they give you medication to just suppress all your estrogen, but you get a lot of estrogen from the food, herbicides, pesticides, hormones, antibiotics. So then what happens is the bile is really, really important. So if the bile is not flowing properly from your liver, getting stored in a storage tank, right, you're in trouble. And then you have a lot of symptoms from that. But in medicine, it's like, oh, no problem, we're going to do an ultrasound. It doesn't work right, we're going to do a HIDA scan. And when the function is reduced, then we'll just cut it off because that was a spare part. God made a mistake anyway, right? So we're just going to take it out. So who wants that? Nobody. So now you eat, it passes the stomach, goes into the small intestine, it goes into the large intestine. And large intestine this is the area that if it's not acidic enough, now remember, every single area of your body has a different pH. Let's talk about pH for a minute. Because if you listen to all those nutrition guru, are you ready? All those nutrition people, they're all like, well, your body should be alkaline. Everything should be alkaline, right? If you're not alkaline, you're dying. People send me texts at 3 o'clock in the morning. Look at this, Dr. Jean-Guy. It's like, I'm sleeping at 3, by the way. I get up at 4. So now listen, are you ready? So when you eat, your stomach should be very acidic. Your small intestine should be alkaline. Your large intestine should be acidic, because when it's not, this is when you start farting. You follow me? So when people fart a lot, it's because they're not digesting, depending if it smells or not, they're not digesting their food there, right? You start having fermentation, which is very common. So then when this whole system doesn't work properly, then you have this thing called inflammation. Anybody knows about inflammation? Right? You wake up in the morning, you're like, I have arthritis. I'm just old. I'm like, no, you're not old, you're inflamed, that's different. And you're inflamed because you eat cake, cookies, candies, ice cream, bread, rice, and pasta. You eat junk. And when you eat cake, cookies, candies, bread, rice, and pasta, and you eat junk, and you're just like, your body is just full of sugar, it's like putting gas on the fire. Right? People do that every day. And when they say they don't do it, they do it in the closet when nobody's watching them, and they still say they don't do it, but they do it. People do it. And sometimes, honestly, people just don't know. They just don't know what they don't know. People like, I swear, they're like, Dr. Junkie, I swear to you, I don't eat any sugar. I'm like, write it down. And then they show me this thing, and I'm like, this is all sugar. They're like, well, I didn't know. Because they think that sugar is just like table sugar, right? They don't understand that when you eat the pasta, it's sugar. They don't understand when you eat the crackers, it's sugar. They don't understand when you eat the bread, it's sugar. They don't understand that, there's sugar in fruit, there's sugar in vegetables, there's sugar everywhere. Everything that you eat that has a label on it, there's sugar in it. There's sugar, it's right there, right? So at the end of the day, the average American will eat anywhere between 300 to 500 grams of sugar per day. The average American will eat somewhere around 150 pounds of sugar per year, right? Some people it's 300 pounds, some people but bottom line, people eat a lot of sugar. When you eat a lot of sugar, you wake up in the morning, you're like, Dr. Jean-Guy, the doctor said I have arthritis. Right? And then you start taking those pills, right? You start taking Norco and Celebrex and all those medication, right? Those are called COX inhibitors. And that's no problem. You take them and then you're like, oh, I feel better when I take aspirin. I feel better when I take my Motrin. I go play golf, right? And I go take some ibuprofen before I play golf and I just feel wonderful. I'm like, oh yeah, that's great. You're gonna have a heart attack, but that's okay, right? Just keep taking your pill. You're gonna feel good. Instead of just stop eating cake, cookies, candies, ice cream, bread, rice, and pasta. Because that's what happened. Because sugar causes inflammation. Inflammation will wreck your gut. So now in your gut, remember, this is like the first tube. Yes?
Yes.
Say yes.
Yes.
That's the first tube. Now this tube there is nice and tight and sealed. It's always been sealed unless you were one of those fortunate people that you didn't have a vaginal delivery and then you're born as a C-section, so you don't have a chance, right? And when you're born as a C-section, then your gut is already destroyed before you start. And then we're going to give you a bottle to feed you because we don't want to breastfeed you. So we're going to give you a bottle with a bunch of dairy, a bunch of stuff that you shouldn't have. And then what happened is all of those proteins going to cross this first tube. And when it crosses the first tube and it's not natural, it's not like mommy's breast milk, it crosses the tube, then the blood sees it and your brain sees that as being foreign to the body and it starts attacking itself. So when people have problems with their gut, they also have autoimmune disease. Autoimmune disease, you know what that is? Autoimmune disease, people have rheumatoid arthritis, they have systemic lupus, they have psoriasis, they have Hashimoto's thyroiditis, they have vitiligo. Those are all autoimmune disease. Because what happened is when that first tube is not sealed, and every time you take an antibiotic, this tube, you're just punching into it to just pierce some holes. And when there's enough holes, right now they call that this leaky gut. When you have a leaky gut, then all this stuff that you eat, it goes through those holes. And then the blood sees that as being foreign because it doesn't belong there. It's not supposed to happen, right? Those molecules are not supposed to get through. But when they get through, the body sees that as being foreign to the body. So it starts attacking it, right? So you have this big war that happened all day long in your body. Matter of fact, this guy was just here today. His name is Steve. He's like, Dr. Jean-Guy, I got to talk to you about something. I'm like, oh, I can't wait. I didn't say that. I was just thinking about it. He's like, I've been fasting for 21 days. This is the best I've ever felt. The best. I'm like, yeah, that makes a lot of sense. Right? 21 days, no food. He's like, this is the best I felt in my life. I'm like, yeah, that's usually what happened. Because when you don't put any cake, cookies, candy, ice cream, rice, and pasta in your body, there's no inflammation. He's like, yeah, now I wake up in the morning and I'm just like ready to go, right? I'm like, because what happened is when you eat sugar and you have low-grade inflammation constantly between 2 and 5 in the morning, your liver detox, and when it dumps all this crap, right, and your gut doesn't work properly, all the crap recirculates into your joints. So then you're like, and then usually people say, Dr. Jean-Guy, after an hour though I'm doing good. Yeah, because once you start moving, then the blood flow starts going, and then the blood comes in and start, getting rid of all the debris temporarily until we go to the next cycle. You see what I'm saying? They're like, yeah, I feel good. I'm like, that's what your body's doing. Okay, I mean, enough on this. I mean, I'm only like 1/4 to this thing. I only have 5 slides and I won't get through it. So here you have all the organs that your body goes through. You have all those conditions. I don't want to spend much time on condition, but I want you to know that all those conditions are all the same. I know it's hard to believe, and there's no medical doctor that wants to hear that, because the more condition we have, the more drugs we can give people. The more condition we have, the more money we can make, the more complex we can make it. But at the end of the day, when it's all said and done, all of this stuff that you see there is when people eat cake, cookies, candy, ice cream, red rice, and pasta, and they've done this their entire life, that you didn't have a vaginal delivery, that you were bottle fed, right? And as soon as you were ready to eat, we just give you sugar, and then we continue to have the cereal in the morning with a glass of orange juice and a piece of bread. And then after that, you have lunch and you have spaghetti because you're trying to diet and it's supposed to be low fat, right? And then you come home and you have a bottle of Coke or whatever you have for dinner and you just eat your ice cream. And when you eat your ice cream, then you just like, this is when you fall asleep, you go, I mean, how do I know that? Because I used to eat gallons of ice cream every day. Every day I ate gallons of ice cream. That was my favorite. And after I was done with the ice cream, I was ready to go to bed. Because what happened is the things you love the most are likely the things you're allergic to, and those are the things that's going to put you to sleep, in case you did not know. Side notes, and believe me, I know just a little bit about it. Because the Schwanzmen, they were making a lot of money off of me. My wife's fault, though, not mine. So all those conditions right here now, all those conditions, same problem. I know, nobody wants to hear that, but same problem, right? I mean, truly. Any one of those people that come in, if you've done a nutrition program with me, the recommendation will be the same. So it's a good thing that you're not there for every visit because you'd be like, he says the same to everybody. I'm like, well, of course, that's a problem. There's one problem, one cause. You cannot just put in crap in your body. You know, Bob here, he's got like 57 fancy cars. He's not going to put water in all those gas tanks. He's going to ruin them. Why would you do that in your body? Now, most people, they don't know. Or, I mean, I'd like to think they don't know until they know. And when they know, then hopefully they do something better. Okay. So those conditions, now there's a little nuance. 80% of your immune system is in your gut. Did you know that your gut is your second brain? Many of you have heard that before. Yeah. In case you don't know, all your neurotransmitters are made like dopamine. That's what makes you, you get your dopamine hit when you surf the internet. If you didn't know, if you never heard that. What makes people feel good in their brain is this thing called serotonin. Did you know that when you eat cake, cookies, candies, ice cream, red rice, and pasta, your serotonin goes down, right? So if you want to be real depressed, just eat more sugar. That's really going to help you out, right? Because that's what it does. When you eat sugar, it just steals all the minerals and your B vitamins out of your system. And your minerals and B vitamins are really important for brain function. And then if you don't have enough protein, then you cannot make this serotonin and dopamine. So then this is what feeds your brain. So there's books out there. It's called, it's called Second Brain. That's your gut. So that's really important. Now, not that any one of you here want to talk about COVID again, but I just, somebody told me that everybody has COVID right now, so may as well I'm just going to talk to you about COVID. I don't know if it's true or not, but people get diagnosed with COVID. Right? People have a cold. So let's say that you have COVID. Would that make any sense that if a person has COVID or whatever diagnosis you have, that maybe eating less sugar that might help you? Yes? If it's 80% of your immune system, would that make any sense? Yeah. Is there some pretty easy strategy for people to just that we already know that people's immune system is going to be better? Right? Maybe you just cut the sugar in half. Instead of eating 150 pounds a year, just eat 75. Right? That would be a good strategy to improve how your immune system functions. So then the way that most folks will address this is they're going to take those proton inhibitors, which is a PPI. They were proton inhibitors. Some of you might be taking that unbeknown to you. Those proton inhibitors, the side effect is it shuts down the absorption of calcium, of minerals, makes you more prone to have osteoporosis, shuts down production of vitamin D. No big deal. You're just going to die faster, right? And then here people take drugs because they want to feel better, so they take NSAIDs. Those are called COX inhibitors. And then those COX inhibitors, what they do is they cause bleeding. But that's no big deal because we got pills for that too. When you have an ulcer, we give you a pill for that, right? Because we got pills for everything. Whatever problems you have, we have pills for that. But you should be you have pain. Your answer should be take some NSAIDs, take some aspirin, just take some Aleve every day. Do you understand how this makes no sense whatsoever? People do that every day. They're just been like, it's in their brain. But on the flip side of that, now listen, I'm just going to pick maybe just one person, right? So people would say like, but Dr. Jean-Guy, you want me to take those fish oil for the rest of my life? I mean, really? The rest of my life? They just can't, they're going to take all their drugs for the rest of their life, but God forbid I ask them to take their fish oil for the rest of their life. I'm like, this makes no sense. I can take the drugs, but just now don't take the fish oil. Do you see how this like... The reason why you should take fish oil for the rest of your life is because you don't have it in your food. You just don't. The reason why you should take vitamin D for the rest of your life is because you don't have it. The reason why as you get older, just so you know, I'll give you a side note. All of you here, 22 and 12, the rest of you here, you're all in the same boat as me. Okay? The freight train is going in the wrong direction fast. And in order for you to slow it down or to reverse it, there's things you're going to have to do. That maybe you didn't have to do at 20, but now if you want to slow it down, you don't have to. But if you want to slow it down, right, there's things that you can do to, it's called biohacking, right? What that means is you can eat the best food that you can, and just so you know, the best food today in 2024 compared to 100 years ago, even if it's organic, there's only 50% of the nutrients. So what that means is, if your liver has been around for 50, 60, 70 years, your heart's been around for 50, 60, 70 years, do you think that it's getting worn out a little bit? Do you think it's maybe not functioning as well as it used to? Yes or yes? Yes. The answer is yes. It's just like, I mean, this is common sense. Don't look at me weird. I didn't do it. It's just common sense. Your heart, my heart is not as good as it used to be. Your spleen is not as good as it used to be. Right? So there's room here for me to say to you that people, there's room for people to be on a nutrition program if they choose to. You don't have to. I'm just telling you. Right? People always say, well, why do you take that? I say, well, you should take one pill for every birthday. They're like, you're crazy. I'm like, I am. But there's a good reason why I am. Right? You don't have to do what I do, but people say, well, what do you do? Well, I'm going to tell you what I do. Because what happened is the engine is getting older. So when there's 700,000 miles on the engine, guess what? The spleen is not as good as it used to be. The liver is not as good as it used to be, so it needs some help. But then people they're turning against me. They're turning against my own word. They're like, yeah, but you said your body can heal itself. I'm like, yeah, but you're 75. It can heal itself when you're 20, when you're not 20 anymore. So it gets to a point where you're going to have to do a little bit more, right? I just want you to understand that. You don't have to. I'm just telling you that if you choose to, you're going to have to move more. Motion is lotion. You're going to have to do more of the raw material, of the right raw material. You're going to have to do more of just about everything, right? Because when you were young, God is gracious. You have a white path. You can do a lot of mistake, and He's going to forgive you. But now you're getting a little bit older and wiser. The path is not as wide. Would you agree with that? The answer is yes. And then some of you, you're like, well, that sucks. I'm like, you're right. But it's still the truth. It is what it is, right? If you remember Christopher Reeves, the old Superman, I mean, for 3 years they tried to do body transplant. That didn't work. Still to this day, they can't do it. For some of you here, you're like, yeah, they're just gonna put a new me. No, God's giving you one chance. That's all you get, right? You only have one chance. And then some of you are sitting here tonight. You're like, well, it doesn't matter. When He calls me, I'm out of here. You're right. He will. We don't know when, but while you're here, don't you want to be the best you can be? Now, those you have to make that choice, right? That's a choice you make every day. So if you look and say, well, Dr. Jean-Guy, what did you do today? It's not what I did today. It's what I've done the past 30 years. I mean, mine is the ice cream at the beginning, right? That was bad. It was bad. I'm just telling you, don't you want to know, like, this guy's human? Yeah, I made a lot of mistakes. I'm giving you my mistake. Now I know better. Okay, so now when people take pain drugs, and it's also bound them up here. People don't have bowel movement. This is important. A lot of people take pain medication, their bowels don't move. Now, if a person has pain, which question you should ask? Why? Yeah, let's find out why do you have pain. See if we can fix that. Okay, so here's the pH of the gut. I'm already ahead of myself. I'm doing good. Right, here it says what's causing the bad flora. So your gastrointestinal tract, your microbiome is the bad stuff. It's caused by inflammation. What's causing inflammation?
Sugar.
Okay, cookies, candies, ice cream, fried rice, and pasta. Then you have this thing here, right? Now we can be more specific. So food sensitivity. So some of you here, or many of you here tonight, here's the story. Right? If you want to know about food, the top 5 food that people have sensitivity to, it's called wheat, corn, soy, dairy, and eggs. Wheat, corn, soy, dairy, and eggs. After that is beef. A lot of people have problems with beef. I don't know why, but they do. Right? I have this girl just driven from Holland, Michigan today. She's like, badly allergic to beef. Some people have beef problems. They don't know. Because you're like, well, that's gut food, Dr. Jean-Guy. I just killed a cow. I'm having beef. I'm like, yeah, but sometimes, the beef's been fed with soy, corn, and wheat, and that might be the problem. Right? And then after that, after the beef is you have tomato, after that you have chocolate, after that you have sesame oil, after, there's like, there's more. But those are the top 5 and it's common. Now, why would one of you here, let's just pretend you're all young here. You're all young to me, right? Let's say that you're 45 and now you come in and you get tested and I say, hey, Pat, I don't want you to have any more dairy. And sometimes when I say that to people look at me, they're like, yeah, but Dr. Jean, I had him all my life. I mean, what's the problem now? Because what happened is, here's the problem. You remember this first compartment that I was telling you about? When that first compartment becomes weaker and it starts leaking, and you start having all this inflammation, then what happened is, there's a time, there's maybe for 20, 30 years of your life, you were able to tolerate dairy, but now you can't anymore. Right? This is just like having kids. You can tolerate them until they're 18, and you kick them out. Okay? I'm tired of you. I'll trade you until you're 25, and then you can go back. Right? When you behave yourself. I know some of you don't know anything about that. But okay, so food sensitivity, wheat, corn, soy, eggs, dairy, it's common. Very common. The top 2 is dairy and wheat. Right? If you want to help your gut, just stop eating wheat and dairy. Now, when this guy left today, I mean, it's amazing. People know. I mean, I don't even need to say anything, right? I'm like, Steve, you did great with 21-day fast. He's like, yeah. He's like, well, what do you think I should do? I'm like, I don't know. What do you think I should do? What do you think you should do? He's like, yeah, those darn cereals and bread. And he's like, I'm just so addicted to that. I'm like, okay. Most people, they already know, right? Now we just got to do it, like the Nike commercial. Okay, here, bugs. So people have problems with bugs because, you feed the bugs with sugar. So, of course, you're going to have bugs. So today, parasites is common, viruses are common, bacteria are common. People have bugs. Now, whether you like it or not, you have bugs. I don't care what you say, you have bugs. This lady last week, she's only like 30 years old. She's a kid. She said, brings me a picture of this tapeworm that come out of her. Right? Because last week, it was a full moon. It happens a lot during the full moon. People have like parasite comes out. I know you think it's gross, but you know what? I mean, it's just like your body will just get rid of bugs. I mean, if you're doing the right thing, but you got to continue to work on your immune system. You got to clean the house, so it's coming. So when people, you got to have a balance. You have bugs in your body, and you should have bugs. However, you got to have balance. And when you don't have proper balance, it's causing inflammation. It's weakening your immune system, and your gut's not going to work right. So when people have condition, right? Let's say you have diverticulitis, colitis, Crohn's. You have those condition that people with the diagnosis, likely you have gastrointestinal bugs that needs to be addressed. And if you don't address them, you're going to be in a constant state of low-grade inflammation. Right? So when people have those diverticulitis, Dr. Jean-Guy, I got to flare up. I'm like, oh, okay, that's a good one. Let me hear it. I got to flare up, Dr. Jean-Guy. I had to go to the doctor. I had to take those antibiotics. I had to, Dr. Jean-Guy. It hurt so badly. We could have a reality show in my room back there. It's so much fun. Just because I can't say anything. I just have to take it in. Take it in like a man. Don't say anything, Dr. Jean-Guy. Don't say anything. Just keep your mouth shut. But it's impossible to have those flare up. Like, it's very unlikely to have flare up on just about anything, right? When you behave yourself. But when you eat cake, cookies, candies, ice cream, bread, rice, and pasta, and you do things you should not be doing, you're going to have flare-ups, right? Not only, it's because you're always on the edge, and you're not doing anything to revert to go the other way. Do you understand that? So now I want to teach you this concept. Are you ready? Here's the concept of getting by versus getting healthy. Because many of you here might be in that lane right now. And it's hard. This is not an easy one. Okay, you ready? Here's the lane. The lane is, but I feel good. I'm fine. I feel fine. Right? So many of you here, you know that my dad passed away when he was 40 years old. He had a heart attack. Right? 40 years old, left behind him 5 kids. So I always tell people, I'm like, listen, my father was my greatest teacher. And the reason why he was my greatest teacher is because you can get by in life, say, hey, I'm fine. Or you can choose to be the best version of yourself that you can. Right? So the reason, like, every single day you can do the things, right? When I get up at 4 o'clock in the morning and I go work out for an hour, when I have breakfast and I take like 50 pills that, you know, people are like, well, you can't be taking 50 pills. I mean, you know, why would you do that? You know, I mean, you're supposed to be healthy. So I'm like, so because you're supposed to be healthy, then you should be taking your supplements. Or because you're healthy, then you should not be eating real food. Or because you're healthy, then you don't need to exercise. Or because you're healthy, you don't need to brush your teeth. Or because you're healthy, you don't need to go to the dentist. Do you see how this is like your wires get crossed and you're just like, well, what happened is when your bucket is right on the edge, I feel fine because it's not overflowing. I feel fine. You can decide based on your choices that you make to take stuff out of the bucket, right? Take the crap out of the bucket to create tolerance, or you can keep it on the edge, right? And the next time you have 1 drop or more than 1 drop, then it's going to overflow. Do you understand that? So today, the decision you make today, tomorrow, the next month, can be the difference between having cancer in a year from now versus not. You see what I'm saying? It could be the difference between, let's say that you get COVID, whatever that is, this new thing that is like creating those spike protein. Why did some people, their spike protein just kills them, another person, they have myocarditis, and the other person, they have nothing? Why? It's because the tolerance in the bucket. There's tolerance in the bucket. Who wants tolerance in their bucket? Sign me up. I want a lot of tolerance in my bucket. Right? So when I'm going to tell you, I should not tell you, but from now on, I'm going to tell everybody forever. Right? 25 years in practice, I've never missed. Like, I'm like a Boy Scout, I always report for work. Right? People are like, well, how do you do that? I'm like, I don't know. I just do it. Don't you get sick? No, I don't do sickness. Don't you get tired? No, I don't do tiredness either. I just don't. Right? You have that choice. It doesn't have to be you. I'm not any better than you. I'm just telling you that you can be healthy if you choose to. But that's a choice. Yes or yes?
Yes.
Okay. We're almost done. You guys are doing me. I mean, really, we're not done, but I'm going to stop because you guys are falling asleep. Here's the SAD diet. The SAD diet is the food pyramid. You can look this up. It's called the Standard American Diet. If you eat like that, for sure you're going to be sick. And then last but not least, it's called stress. I know some of you don't have much of that. Just joking. I mean, that's so important, right? I teach classes on that. We're going to have one next month. You should be there. Stress is really important. Now, there's 2 kinds of stress. That's important to understand, right? You have the stress that you perceive, and you also have the stress your body is perceiving. Does that make sense? So some of you maybe you're like, hey, my life is good, my relationships are good, my kids are good, I have nothing to be stressed about. But let's say that you have parasites in your body, that's stressful. Let's say that you eat dairy and you're allergic to dairy, that's stressful. So the stress can be what's in your environment, what you perceive, but it can also be what you're doing to your body, unbeknown to you. You follow me? This portion is important because you have to be aware of that. So stress is real. I was listening to this podcast. One of my favorite person to listen to. I won't tell you who that is. And then he says 70 to 80% of the visit, right, of the visit to the doctor in a year, 70 to 80% of them, right, has to do with stress-related condition. Any of the visit in the US in a year, right, 70 to 80% of them. That's a lot of them. Because what happened is stress is the fuel for chronic illnesses. Okay? Stress is a fuel for chronic illnesses. Are you ready? So we have a lion, it's in the cage. And the lion did not eat for 21 days, just like my friend. Did not eat for 21 days. Then you open the door. And then he sees you. And then you're going to be the lion's next meal. What would you be doing? You would be running real fast. I heard stressing. Yeah, that would stress some of you, including me. Right? I'd be running for my life. And I'd be like, this lion's never going to get me. I'd be running as fast as I can. Now, so let me just tell you what happened. So if you were to run for your life right now, what would happen to your blood pressure? What would happen to your blood sugar? Because what happened is when you run, you need energy, so your sugar needs to go up. Your blood pressure needs to go up. Any one of you here tonight, I send you around my building. I said, I want you to run as fast as you can, 2 laps, come back and take your blood pressure. What would happen? It will go up, right? So your blood pressure is going to go up, your sugar is going to go up. And then guess what's going to happen to your hormones of stress? Are they going to go down or up? You think cortisol is going to go down or it's going to go up? Do you know what cortisol does? Not only when cortisol goes up, the reason why it's going up, right? Because it's managing stress in your body. It's managing your blood sugar. It wants to keep the sugar high at all times so you can run faster. And also cortisol, what it does, it mobilizes fat, right? So do you think you're going to have less fat or more fat in the bloodstream? You think you're going to have less cholesterol or more cholesterol? I'm going to give you a hint. You have more, because what happened is if the lion happened to bite you and you start bleeding, the way that your body's going to heal itself is it's going to use cholesterol to do that. It's for wound clotting. And then your brain's going to send a signal to your liver to downregulate, right, the insulin receptors on your cells. Now that's Chinese for you, but I'm going to make it in French. Are you ready? When you downregulate, right, the insulin receptors on your cells in your body, the insulin, what it does, it allows for sugar to get into the cells. So when the insulin downregulate, right, then what happens is your blood sugar stays high at all time. So now you have high blood pressure. Now you're becoming a diabetic. Now let's say you're running for your life. If somebody scares you, you're going to crap your pants. However, let's say you run for your life, right? You are likely that your gastrointestinal tract is going to shut down because you don't have time to poo or pee. Would you agree? No time for that because you got to run for your life. So if you don't have time to poo or pee, then you're going to start developing acid reflux because it goes with it. That's the next disease you'll have, and we have a pill for that too. And then the next thing that's going to happen is, do you think that when you're running for your life, if I was to give you a very complicated math problem, right? If I give you a very complicated math problem, except for Pat here, but everybody else here. Let's say you're running for your life, and I'm giving you a very complicated math problem, and you're running for your life. Are you likely you're going to get the math problem right? No. The answer is no, because who cares about the math problem? You're going to run for your life. So your attention, focus, concentration goes, right, down, because it's just part of it. And then guess what's going to happen to your immune system? Your body, your body does not care about your immune system right now about an infection. So what happened is when you run for your life, your immune system, the ability of your immune system to sustain itself is not going to work. There's genes in your body that's going to be down-regulated, right, for your immune system not to work. Can you see the picture? So then what happened is when people have this here, right, naturally when you have this, all the disease, chronic illnesses comes with it. You have high blood pressure, you have diabetes, you're taking your cholesterol pill, you're taking your PPI, you have cancer, right? All of this, it all comes with it just like that. And we have a pill for every one of those things. You see? They rigged the game. It's rigged. She's like, I'm depressed now. Right? So I want you to understand that. This is super, super important. And when you get it, then it's wonderful. We're almost done. A couple slides here, we're done. Okay, then you can ask me some questions. Solution. No, we're in a solution. Now we went over all the problems. You're all depressed now. I'm going to lift you up. Right? So here it says you got to eat some more food. You got to try to stay away as much as you can from all the meds possible. right? Especially the pain stuff, the PPI, anything that is for gut. Because it's not gut health, it's gut destruction. And then here you gotta manage your stress, you gotta have proper nerve system function, yes? I know some of you here, you don't really like understand this part, you don't wanna be part of this part, right? If you're just like some people that I've met in my life, I still do today, because I do, healing is my thing, right? There's some people, they're like, oh, God's gonna heal me. I'm like, oh yeah, I'm sure God wants to heal you, but he also wants you to take care of yourself, right? Or there's other people, they're like, oh, no problem, the trainer is gonna fix me. I'm like, yeah, the trainer is concerned about exercise. He's not, if you exercise and you go eat cake, cookies, candies, and ice cream, it's not gonna work, right? You cannot exercise your way out of bad diet, yes? Does that make sense? I mean, just think about it for a minute. It's just that you cannot exercise your way out of bad diet. I'm gonna tell you something, and I don't want you to be, don't be mad at me, I didn't do it, right? People are like, well, Dr. I keep putting weight on because I can't exercise. I'm like, no, you're putting weight on because you don't have a zipper in your lips. Okay, that's the reason why you're putting weight on. That's the only reason. Do you understand that? I'm not telling you not to exercise, you should. Every one of you here, you should. But the reason why you're putting weight on is not because you don't exercise. It's because you are eating cake, cookies, candies, ice cream, bread, rice, and pasta. That's the reason. There's no other reason. It's because you're putting junk in your body. Understand? So please don't ever say that to me because you'll know what I'm thinking. I won't say it. But I just want you to know. Right? Now, I'm a fan of exercise. You guys can come with me any time of the day. I mean, I'll take you out. Right? And I like it when it's a little bit uncomfortable. Right? Because that's just me. I'm just kind of, okay? Proper nervous system function. If your brain and nervous system doesn't work properly, you're never going to be the person that you can be. Right? And if you don't believe that, you need to educate yourself. There's this lady, her name is Heidi Havoc. She has a PhD in neuroscience from New Zealand. She spent the last 25 years of her life to study how the spine and nervous system has an impact on brain function and your health. The lady's amazing. Here it says move your body, motion is lotion. And then here it says see next slide. See, that's my reminder. In case I lose my focus, concentration, and attention because I'm stressed out. You guys are stressing me out. That's why I put a reminder. So here it's step for healing your gut. So when I work with people, right, this is the first thing, is you first want to remove the stuff that is causing the damage. Step 2 is you got to replace it with stuff that's going to be healing. Right? Number 3, it says you got to repair. So you remove, replace, and then you repair. And then here it says specific supplements to heal the gut. So here's what happened. I understand some of you don't want to hear that. Just I'm going to tell you because I'm just like, you're here now and I'm going to torture you. Right? You're like, well, Dr. Jean-Guy, can I just eat good and I'll be fine? I'm like, oh, you can try. It's not going to work, but you can try. Okay, why is it not going to work? Because likely you're not going to do it. And if you do it, because those food only have 50% of what they used to have, it's not enough. It's not enough of a therapeutic dose in order to get you to where you need to be because now you're all falling apart. Do you understand that? Now, should you eat good food? The answer is yes. All of you here, with no exception, that's what you should do. However, if you truly have a gastrointestinal problem, right? You've been having a problem for a long time, it is likely that you need some help. That's the reason why when we test people, we can get through that process. You're using some specific nutrient that we can put some, we're not putting water in the gas tank, we're putting only premium, right? So the body can heal itself because now you're putting the right raw materials so the body can turn around. Now, the first line of action is always to eat more food, always, always. But then after that, you need to have a little boost here so you can get to the next step, so you can get some. Remember, the freight train is going the wrong direction, right? You're just about to jump off the, how do you call that? The precipice? I mean, in French, that's the word I use. Is that how we use it in English? Yeah. You're going the wrong way and you're real close. You need to slow it down, stop it, and go the other way. So here's the repair. Then it says rebalance your microbiome with probiotic, right? So so let's talk about food here for a moment. So we talked about things not to do. Now the things to do is you should do things like that are, real food. Fruits and vegetables are high in fibers, so you definitely want to do that, right? It's like a scrub to the gut. Twice as many vegetables you have fruits, and then you want to have some fermented stuff, right? So like sauerkraut, kimchi. Some people, if they can do You know, kombucha tea, yes? So those are fermented things. Things that are fermented bring some good bacteria into your gut so you can restore the health of the gut, right? Now remember, you take one antibiotic 1 times 2 years, right? If you've taken 12 of them, you cannot just do something for 1 day, it's gonna be all better, yes? One step at a time. Understand that healing takes time. Can you say that? Healing takes time. I mean, God can heal you like that, but in the natural world, it takes time and repetition, yes? So you gotta have the good bacteria, eat fruits and vegetables, and then your gut's gonna start getting better. Get the inflammation down so it will start repairing on its own. The water you should be drinking, right? People should drink half of their body weight in ounces. So if you're 200 pounds, it should be 100 ounces, yes? There is such thing, by the way, as drinking too much water, in case you did not know that. Sometimes people are like, yeah, Dr. John, yeah, drink a lot. This lady, she was 4 foot tall. She brings a bottle, it's 4 foot tall. She's like, I'm having a competition with my friend. I'm like, you don't need to compete with your friend on that. And I'm not kidding. I mean, the bottle was this tall. So there is such thing as like half your body weight in ounces. Fibers, most of the fibers are found in fruits and vegetables. If you don't have enough fibers, of course, you'll be constipated. You're gonna have issues with your bowels, right? Not drinking water with meal. I wrote this today because many times, I'm assuming people know, but people don't know when I tell them that, right? So let's say you drink like, we're just gonna use common sense. No PhD nutrition, common sense, just only for 30 seconds. Ready? So let's say you drink water at mealtime and the water goes into your stomach's supposed to be acidic to break down the food. If you drink more water, you're gonna have less acid or more acid, right? It's gonna be less acidic, so less chance to break down the food properly. You see what I'm saying? So I say to people, and I would say to Sharon, you can drink water, but drinking outside your meal. At mealtime, you wanna sip on it, but you don't wanna drink a whole bunch of water. Yes? Common sense, just for 30 seconds. Here it says apple cider vinegar. Apple cider vinegar at mealtime is good because apple cider vinegar is gonna acidify your stomach. It's gonna help to break down the food. Apple cider vinegar is good it makes it an unfriendly environment for yeast. It's good for the cardiovascular system. It's good to decongest your liver, right? If you have type 2 diabetes or if you have problems with your blood sugars, you take some apple cider vinegar at night, a couple tablespoons with water. And then having some fermented food, right? This is the KISS principle. Keep it simple. Yes? We don't want to make this complicated. You know all this stuff already. I always say the same thing. Only 20 years, you know. Okay. So here it says, what should I eat? In order to seal the gastrointestinal tract, we have this thing called bone broth, which most people are familiar with. Anything that is raw, here it says raw dairy. So Dr. Jean-Guy is not a huge fan of dairy. However, not that I'm not a huge fan of dairy, but a lot of people have sensitivity to dairy, so if you do, you shouldn't have it, right? Even if it's raw. In the state of Michigan, you cannot buy raw milk, but you can buy raw cheese. Or unless you have a cow, right? If you own a cow, then you can have raw milk. Or you can own a share of a cow. Fermented vegetables, you can ferment anything now. Coconut products, sprouted seeds, like chia seed, flaxseed, hemp seed, this helps to bulk your bowels. And then food with omega-3 fatty acid like salmon and other wild-caught fish. And then herbs and spice, as long as they're quality, they don't have a bunch of other things in there. Other nutrient-dense anti-inflammatory food like grass-fed beef, lamb, if you're not allergic to beef, right? It's always like, if you don't have sensitivity to those things. And then it says vegetables, fruit, apple cider vinegar, vegetables, other superfood. Okay, so we have some repeat there. Understood? Understood what you need to do? When it's all said and done, you have a problem, you need to ask the question, why? And you need to stop eating. Yeah. And then here, this is when there's many things you can do on your own, obviously, because I've told you you have many things you can implement before you leave this store tonight. But maybe some of you here, you're like, hey, you know, maybe I need some more help. Some of you already do this because I've met you, known you. You've already been on a nutrition program, so you've been working with us chiropractically, nutritionally. But if you've never done it, right, then you want to engage with that. This is the principle behind it. So when people have some digestive issue because they've been eating too much, very good. And then you have what? nutritional deficiencies. Those nutritional deficiencies do what to the organ? Yeah, they start breaking them down, right? So now there's dysfunction and there's disease. Now listen to me for a minute. There's dysfunction and disease. A person don't go from health to having cancer the next day. Yes? Does that make sense? You go from health to have dysfunction and then it leads to disease. Okay? Understood? So you have health, dysfunction to disease. So this guy comes in, Peter. He says, Dr. Jean-Guy, I love when you just test me, and it always amazes me because I went to the doctor, and you just told me I had a virus, and I go to the doctor, he takes my blood test, and I had a virus. Right? And I'm like, thank you, Jesus. But let me explain something to you. It's important to understand that sometimes people say, well, Dr. Jean-Guy, do you treat cancer? No, I don't treat cancer. I don't treat any condition. I treat the body. Do you understand that? That's the difference. When you look at the body from a holistic perspective, it doesn't matter what people have when they come see me. Right? I always do the same thing. I know that sounds boring. I know you don't like it. You're like, he always does the same thing? Yeah. One way or the other, I'll tell you not to eat sugar. One way or the other, I'll tell you to move more. One way or the other, I'll tell you to make sure your spine and nervous system works properly. One way or the other, I'll have you put your feet on the ground so you can do some grounding. One way or the other, I'll have you look at the sunshine when it comes up and when it goes down at night. One way or the other, I'm going to have you do things that are healthy for you so you can gain health. You understand that? Right? One way or the other. I mean, I'm pretty boring. I mean, I know one or two things, but, you know, I mean, they don't really matter at the end of the day what I know. So when we do this nutrition response testing thing, when we do this here with people, right, this is really like, like being a detective to get into the vault. Right? Getting into the vault. Any of you like you have a vault like a safe for your guns? I mean, you know, I only have one. I mean, maybe two. I mean, Chuck's got 5 of them. But, so now here's what I have. So we're going to have a volunteer here. You know, Sharon's going to volunteer. Sharon, come on. Usually I pick on Pat, but not today. So here's what happened. When we do this here, with nutrition, the way that we apply in this office nutrition is we do this thing called nutrition response testing, and we do this. So Sharon's going to give me her arm, and we practice today. Right? Just so you know, we practice. We practice. So when I tell her, Sharon, be strong, she'll be strong. When I tell her to be weak, she'll be weak. Okay? Because we practice. Be strong, Sharon, right now. And I say, Sharon, why don't you go ahead and hold it? Right? So this is called muscle testing. Muscle testing has been around for 100 plus years. Long time. So now our brain has to focus on one thing only. And then I'm going to be touching some acupuncture reflex. Those are neurological reflex. So in acupuncture, this is the lung reflex. Be strong. And she's strong. In acupuncture, this is an immune system reflex. She's strong. This is another lung reflex. She's strong. This is the liver reflex. And now she's weak. Right? Now she's weak. We practiced today. She's weak. Why is she weak? The reason why she's weak is in the body, if there's any problem in the body, right, and you touch it. When I do this here, if there's a problem with our liver, and I touch the liver reflex, you're creating an ischemic reaction. What does that mean? Ischemic reaction means less blood. You're stressing the nervous system. And when you stress the nervous system, now the brain has to focus on this, and it has to focus on that at the same time. I know you ladies can focus on a lot of things, but I'm just telling you that as soon as you have to focus on more than one thing, right, then what happens is it will reduce the energy in our muscle testing, and now she'll become weaker. She'll become weaker. She'll become weaker. Okay? Keep your arms strong now. You're strong now. Okay? So it will reduce the energy. So let's say that her liver reflex is weak. Right? Now I go over a lung reflex, she's strong. I go over the immune system reflex, she's strong. The other lung reflex, she's strong. The heart reflex, she's strong. The liver is not strong, it's weak. Now what you can do is you can bring some food. This is food, right? Food. Food has energy, in case you did not know. If you're in your car in the middle of the summer like today, you're in your car. And it's hot, right? I mean, how do I know that? Because everybody comes in, lay hands on them, they're all wet. And I'm like, what happened? Now, if you're in your car and it's hot, it was hot today. Now, let's say you roll down the window. Is it still hot? Yeah, it's still hot. So the glass here is like the window in your car. And then inside you have food. Food has energy. You can measure energy of anything. If you don't understand that, it's quantum physics. You have to go look it up. Okay, that's going to be for the next talk. But so now there's food, and food has energy. And now I'm going to say to her, I'm going to whisper to her, but she's not talking to me because I don't really like to talk to Sharon. Right? I just want to talk to her body. I'm going to whisper to her, and I'm going to say, do you like this? Hold it. And now she's strong. Because what happened is if the body likes it, right, it's going to energize her, meaning that it's going to empower her. It's going to make her stronger, and now she's strong. Now I say, okay, this has become part of your nutrition program. This is for you because your body likes it. Okay? You can whisper to the body and say, do you like this? Without me asking her, because it doesn't matter what she says. I mean, she's smart, I'm smart, but we're not that smart. So you can ask the body specifically. Now, if I take sugar, right, if I take sugar, and I take the sugar and I put it over her body, and I say, okay, Sharon, go ahead and hold it. 100% of the time, doesn't matter any one of you here, I'm taking you down right now. Right? How do I know this? Because I've done this for 25 years. Sugar right here, put this on your body. I can muscle test any one of you here and you're going to be weak 100% of the time. Because sugar is poison. And sugar will disempower you and it will make you weaker 100% of the time. And how do I know this? Is because research has been done. Muscle testing has been around for a long time. And this worked 100% of the time. So if she likes it, now this becomes part of her program. Right? It's like, in order to get into the vault, you have to have the right combination at the right time to get in. Do you understand that? Right? So when we do nutrition response testing, is you can get into the vault because you have the right combination at the right time to get in. And when we test people for what they need nutritionally, but we also test to see if they have any toxicity. So we can also test for food sensitivity, for bugs, for parasites. Right? This lady there was only like 30 years old. She had this tapeworm coming in. Well, I mean, a month before that, she knew she had parasites. She was taking nutrition for parasites. Right? I always tell people take pictures. They don't really like to do that. I mean, once in a while, people send me some pictures. Right? And I'm like, oh, that's cool. Your name is not on it, so I can use them. Right? It's not a HIPAA violation. Right? But I want to see those parasites coming out. So you can test for bugs in the body. You can test for chemicals, heavy metals. You can test for if there's any food sensitivity. You can check for all of those things. Right? So we also check for all the vaccine. I know I'm not supposed to do that, right? But I'm just side notes, hopefully we're not recording this, but we also check for, people for vaccine adjuvant. Do you know what vaccine adjuvants are? All the fillers they put in there, the mercury, the aluminum. Do you know that it's just going to make you lose your cuckoo faster? Do you want that? Or who would like you to take it out? Right? You can test for that. And you can start taking this stuff out. Who wants to keep it versus getting it out? So when we put a person on a nutrition program, right, this nutrition response testing, we design clinical nutrition programs specifically for that person. Okay, this person here, they're going to take this program, but that person here going to take something different. They could have the same condition. I could have two people with gut problem and they're on two different programs. Why is that? Because they're different. Their needs are different, right? You can go into the vault and you can just open up the safe. Who wants to open up the safe? Right? That's the safe of improving your health. So nutritionally, that's what we do with people. Sharon, you did an amazing job. I'm going to pay you for this. Okay? Amazing. I'm going to practice again later. I'm not sure you did such a great job. That's okay. I think you did pretty good. Right? So you can get into the safe. So when we do those programs, right? When we test people, when we evaluate people on the first visit, we first want to know, like, what's your problem? Right? From a nutritional point of view, just like we do chiropractic. We first want to know what's causing the problem. Yes? It's first thing. And anything that you do, you want to find out what's causing the problem. That's number one. Number two, right? So we have this whole questionnaire that people do because questions is kind of important, right? You can find out a lot with questions. So for instance, if I teach a cardiovascular, people having problems with their heart, in acupuncture there, if you have like a crease in your ear, right? We know that those people are they're much more prone to likely to have heart disease and to have issues with their heart. If you stick your tongue out and you lift your tongue up and it's all blue underneath your tongue and purple and dark, I know that your liver is congested. Your body's going to tell you those things. If you have a bunch of skin mark on your body and all those little things that are coming out, you're like, I'm just old, that's why. No, skin mark, when they start coming out from underneath your armpit and everywhere, there's a reason for that. There's not enough enzymes in your body to break them down. But people are like, well, I'm just getting old. Well, if you want to believe that, that's okay. Right? If you have those little red hemangioma, those little red spot on your skin, people have that. Especially, usually ladies have that. Men will have them too. So that means you're estrogen dominant. Right? So your body's going to tell you things, but if you don't pay attention, of course, you're just going to, it's all passing right by you, and the next thing you know is you have cancer and you're in the doctor's office. Yes? But there's many of those things your body tells you there's a problem. So if you have indigestion, is it better to go to the doctor taking your PPI, or maybe find out why you have indigestion? Why? Okay. Right? So when we ask those questions, I always like, questions are everything. So you can ask questions that are specific to issues in the body. And then number 2 is we do this thing called the heart rate variability. That tells us how the organs are functioning. If you've never looked into heart rate variability, it's magnificent. There's thousands of studies on heart rate variability. And then we do this thing called the body composition analysis, which tells us about low-grade inflammation in the body. Because that's kind of important. Right? When you have, like, there's 3 kinds of fat in your body. How much? How many kinds? 3 kinds of fat. Now listen to me. That's important. Then I'm going to let you go. Okay? Then I'll give you an opportunity to sign up if you've never had a nutrition evaluation. 3 kinds of fat. You can have fat. If I take your skin off and I see fat, that's the first kind of fat. That's the least damaging to the body. Then if I go underneath your skin and deeper, right? If I go past your 6-pack, or 1-pack. One of the 2, either 6 or 1. So let's say you get past the 1-pack, right? Underneath there, the fat that is around the organ, right? This is what, when there's fat there, there's too much fat, you should have some, but when there's too much, it's choking the organ. More likely to have heart disease, cancer, and any of those things, any of those chronic illnesses. And then you have a 3rd type of fat is when the fat infiltrates into the organ itself. Like when people have fatty liver. Fatty liver? Lots of people have fatty liver now. You have fatty liver because you eat too much what? Yeah, cake, cookies, candies, ice cream, bread, rice, and pasta. You don't even need to drink. Right? People are like, well, you must be an alcoholic. No, you don't have to drink. There's more people having non-alcoholic fatty liver than ever before. They don't even need to drink. Because when you eat cake, cookies, candies, ice cream, bread, rice, and pasta every day, it's going to happen automatically. It's just like drinking your beer. Because that's sugar too, right? The good news is you can turn all of that around, right? Your body can heal itself. You just need a little help. Does that make sense? So when we evaluate the person, you can find that out, which is truly amazing to be able to dial that in, right? To know specifically the needs of that person, and then you can work with them. Dr. Jean-Guy is not opposed to blood tests and saliva tests and pee tests, poop tests. I'm all cool with all the tests. Right? I have no problems with no tests whatsoever. People are like, well, Dr. Jean-Guy, do you think I should get this test, that test, this test? I'm like, you should get them all. Right? Because the tests are just giving us information. What Dr. Jean-Guy is not a super fan of is when we talk about treatment. Because the treatment, when you're going to do treatment, you want to try to do to take care of the what? Take care of the cause. Thank you. There's one person that was listening tonight. The rest of you are just like, okay, I'm ready to go. Right? You want to take care of the cause. So if this is your next step for you, right? When we do this nutrition response testing, you've never had an evaluation, you should sign up. Right? This young lady here, her name is Gabrielle. She's in the back. She's waiting for you. She's going to wave. She's all in black. The woman in black, she's right there. Right? And when we do this nutrition evaluation, usually we charge people $200 to do that on their first visit. But when people come into one of our workshops, it's $99. Right? And this takes you all the way through the report of findings. And then we can report to the person and tell them what's going on with them. Right? And this is all part of that $99. And if I don't think I can help you, right, we're just going to tell you, I can't help you. That's all. That's pretty simple, right? Matter of fact, some of you, if you've never had the chiropractic evaluation, right, and you want to have a chiropractic evaluation, you can have that too, right? We usually charge $320 for that. We will do $99 for the same thing, right? Why do I do this? Because I'm telling you, people don't know what they don't know. The only thing that people know many times about chiropractic, and maybe you were one of them, maybe that's you right now, you're like, but I feel fine, but I don't have any pain. I'm like, who cares? Right? Your brain and nervous system controls and coordinate every single thing in your body. Every single thing. If I was to tell you this lady just had a reevaluation today, Anne, and she's like, well, I didn't want to tell you, but I used to pee my pants every day. Right? And I'm 65 years old, and that was really embarrassing. And since you've been adjusting me, I don't pee my pants anymore. I'm like, oh, that's nice to know. She's like, don't tell nobody. No, I have it. It's right in my box right now. I can show you. I can just cross her name, right? This year we have half dozen women that could not get pregnant. They got pregnant, right? This has nothing to do with pain, folks. Nothing. Zero. Right? So what does that tell you? This guy comes in, he's got Parkinson, right? He's walking like this. I mean, he used to walk like this. He's like, yeah, I've been diagnosed with Parkinson now for 10 years, and they're telling me the reason why I'm doing so well is because I've been on the regular chiropractic care. Thank you, Dr. Jean-Guy. Motion is lotion, right? If your joints don't move properly, your brain is dying. So do you want that for yourself and your family? Right? So people are like, well, do you adjust your kids? I'm like, yeah. But Dr. Jean-Guy, do you get adjusted? Sometimes Dr. Randy's on the table and I'm on the table and people are like, and I'm like, yeah, that's my first one. Never been adjusted. No, my mom took us like 58 years ago. She took my sister to the chiropractor because she had asthma. Right? And I've been going to the chiropractor for 52 years. 52 years. People were like, when do you get adjusted, Dr. Jean-Guy? I mean, you must not need it. You've had it for so long. I'm like, oh, yeah, don't brush your teeth anymore. You don't need that. You've brushed them for so long. Right? I've been adjusting my whole life, every week, every 2 weeks. Why do I tell them? I mean, if I'm going to do something, I'm going to tell you the same thing. You can choose not to do it. But when they look under a microscope, like, who cares about what Dr. Jean-Guy says? Because it's probably not true. But when they look under a microscope and they look at when you immobilize bones, and they look under the microscope and they want to find out how long does it take before you start developing arthritis, the number is 14 days. That's all it takes. Right? 14 days, if bones don't move properly, start having arthritis. So guess what I tell people? My best recommendation is to be adjusted at least every 2 weeks. But Dr. Jean-Guy, I feel fine. I'm like, who cares? But Dr. Jean-Guy, I will know when I need an adjustment. I will know because I'll feel it. I'm like, I'm the chiropractor and I don't know. What makes you think that you will? Right? I'm sharing with you everything going through my mind tonight. I'm telling you everything. That I never get to say that to people. Right? Because I got to keep my mouth shut because they're like, Dr. Jean-Guy, you're crazy. And I said, I am. Okay, so you can write this down before you leave. Are you ready? Then you can leave. I'll answer like 5 questions and you can write this down. Are you ready?
Yes.
I want you to write down success. Success leaves clues. And maybe you meditate on that tonight, okay? This was my last words. You can ask me a handful of questions. You can go schedule your appointment. Success leaves clues. All right, and what does that mean in the context of your health? Is if you want to be healthy, just look at people that are healthy and see what they do. And that might help you out. I'm not sure about all of what's on the internet though. Right? Maybe half of it is true. And the other half is not, so you have to know a little bit more. But success leaves clues. That's why I decided now, as of the last workshop, I would tell people for every workshop from this point on, I'm going to tell people what I did and what I do and what I've done, right? Because sometimes people, they don't really understand that it's really possible. And it is. I want you guys to know that it's possible. Okay, so I'll take 5 questions. Who's going to have the first one? I did such a great job. You guys are just want to go home. Go ahead. Well, you're going to have to pick that one up. She says, how do I get my husband to exercise? I'm like, what do I look like? A miracle person?
I have a question. Should you eat pork?
Should you eat pork?
Yeah.
I don't know. It just depends.
Well, I saw your list, but then you kept walking by and I couldn't write everything down.
I don't think it says pork there.
Is it beef?
I don't have any problem with animal protein. Some people don't eat pork because they believe that, pigs, they only have one compartment and they're more likely to have parasites and all that. I think it has to do with so as it relates to animal protein for me, this is just Dr. Jean-Guy talking to you. Right? I know the Jewish people, they don't eat pork and they follow their, what it says in their book there for those particular reasons. But as it relates from a health perspective, we have pigs at our house. Those little pigs, they just graze, they just eat what's on the ground. Right, so to me, I think those animals is like, how were they treated? Were they stressed out? That's important. I know you think I'm joking, but, you know, I mean, how did those animals are treated? Because this determined that, did you know that when you stress animals and you just take them to the slaughterhouse, that they have a lot of those hormones into their meat? True story. Right? So, how are they treated? Right? At our house, our chicken, just so you know, it's like the Ritz-Carlton. You know, my wife is like, I don't know, she's like, takes good care of those guys. So, yeah, so the way that they were treated, I think that matters.
And the chicken.
And the chicken and the beef and, you know, all of it, right? To me, that's my rule. I always like, when you have something in front of you, the question is, where did it come from? What was it eating? Right? At our house on the, you know, those cows, they're just eating grass, and then we harvest the hay from the land, and we just give that, you know, in the winter when they cannot eat that. So sometimes it takes 2 years, 3 years before they go and get slaughtered. I mean, it doesn't really matter to me. Time is, I do it for the health of it, not for, you know, the financial part of it. But most farmers and people that are into that business, you know, the financial is a big thing. Right. Okay, that was question number 1. Who's got number 2? Yes, Jeff.
My concern is the thyroid.
Yes,
A lot of women have problems with hypo or hyper.
yes.
So to find out the cause, and what they do is they do the blood testing to find out the TSH 3 and 4, which they treat the level peroxide giving it, which treats the blood, but it doesn't treat the thyroid. So can you give us some insight?
I don't know anything about thyroid. I'm clueless about that. I don't teach those classes. I'm just kidding. So the question is, as it relates to thyroid health, the question is like, what you need to do for that is, in the blood test, you want to make sure that you do an expanded thyroid panel, which means that you should have the TSH, TPO, thyroid globulin antibodies, T4, T3, reverse T3, and then you can find out watching the whole movie, right? TSH is only one number, and it's only looking at 10 seconds of the movie. So you want to find out the whole movie. So when I teach this thyroid class, which it would take another 2 hours, I'm not going to do that to you. But there's 6 different reasons why the thyroid might not be working properly, and it's very rare that it's the thyroid's fault. So it's usually there's other players, right? The pituitary might be having problem, the liver, conversion of thyroid hormones happen in your liver. A person could have issues with being estrogen dominant, a person could have an issue with being anemic, so all those things can play a role into thyroid health. So the way that we address that nutritionally is when we muscle test and we do an evaluation, we can find that out. And then I completely welcome people to get those tests done, so then I have a better, you know, a deeper insight as well. And those are pretty, you know, it's pretty easy to do. The regular doctors, sometimes they don't do that because they don't know how to read them, even the endocrinologists.
No, they just give you the
Yes.
level peroxide, which has the same side effects as having a low thyroid.
Yes, yeah. Question number 3. Who has the question? Really? I'm ready to go. I can go on. Really? Okay, great. So this young lady right here, her name is Gabrielle. She can sign you up for your nutritional evaluation if this is your next step. Otherwise, we're gonna have our next workshop. What is our next workshop?
September
Gabrielle?
12th. September 12th.
Okay, sometime, yeah, that could be like a perfect timing because it's not gonna be me, right? If you're like, I didn't like this guy, it's not gonna be me, so you're safe. We're gonna have another dinner with the doc next month. Now that's me. It's gonna be called How to Bulletproof Your Immune System. And we're gonna do that next month. This is, I do all the dinner with the doc the 4th Monday of the month. And our next is gonna be next month. Is it next month? Yes, the 4th Monday of the month. How to Bulletproof Your Immune System. Please bring your friends. Or send your friends and just don't tell them, you know, what they're getting into.